The UK could become the first advanced economy to raise taxes after the coronavirus pandemic drove up healthcare costs. Prime Minister Boris Johnson wants taxpayers to shell out up to $700 a year. He says it'll help increase hospital capacity and provide affordable healthcare for the elderly. But his plan is facing plenty of opposition from businesses, healthcare service providers, and even some from within his own party. Mobin Nasir reports.
As COVID-19 infections surged in January, so many patients began arriving at hospitals in the UK that many of them had to wait in ambulances. The healthcare system was pushed to the brink again in July when another wave of coronavirus cases hit. Taking care of the sick, providing inoculations and financial support during the pandemic has cost the UK almost $650 billion. Now, Prime Minister Boris Johnson wants to introduce a new tax to pay for spending on healthcare.
From next April, we will create a new UK-wide 1.25% health and social care levy on earned income hypothecated in law to health and social care, with dividend rates increasing by the same amount. This will raise almost £36 billion over the next 3 years, with money from the levy going directly to health and social care.
For most taxpayers, this means paying an additional $350 to $700 each year. Personal care expenses will be capped, so people won't have to pay more than $118,000 in their lifetimes. And the government says more funding for the national health system will increase hospital capacity and allow 9 million more medical procedures. Business owners say the tax burden is too high and comes at a time when they're already struggling. There's also opposition from within the ruling party's own ranks. Many Conservative members of Parliament oppose any new taxes.
This rise will impact the wider economic recovery by landing significant costs on firms when they are already facing a raft of new cost pressures and dampen the entrepreneurial spirit needed to drive the recovery.
But the government says the healthcare sector urgently needs a financial injection.
Before the pandemic, 9 in 10 people were treated within 24 weeks. Now, it's 45 weeks. Today, we have a backlog of 5.5 million people and the potential for that to rise even higher. I think we can all understand why this has happened. But none of us on this podium are prepared to stand by and watch that figure go as high as 13 million, which is what would happen if it was business as usual.
Healthcare workers, many of whom have been demonstrating for better pay and more resources for months now, say the spending is not nearly enough to meet their demands. And service providers say the government hasn't laid out a framework for how the money will be spent, leaving millions of vulnerable people without adequate care, even if the new tax is imposed. Mobin Nasir, TRT World.
Well, let's get more on this now with Denis MacShane, who joins us from London. He is a former UK Minister for Europe and former Member of Parliament for the Labour Party. Good to have you back with us, Denis. On the face of it, this plan does make sense. We know the UK's finances have been battered by this pandemic on huge spending measures, be it the jobs retention scheme, also the billions spent by the Bank of England to prop up the economy, and needless to say, the healthcare costs incurred because of the pandemic. But what's unusual is the fact that this policy is coming from a Conservative government. Let's put the politics aside for a moment. Do you agree that something needs to be done to boost the coffers?
I do, but I also agree. I'm flabbergasted because this is what only the left of the Labour Party was saying in the last 10 years. Labour under Tony Blair was fiscally very prudent, as you know, and Boris Johnson seems to have donned all of the socialist clothes that Labour hasn't been wearing for some time. This is the biggest single increase in taxes since 1950. The share of the tax produced, not the tax, share of the wealth that the nation produces now being taken by the government is higher than at any time in more than 20 years. And Britain is heading in what by any definition is a much, much more left-wing, state-controlled, statist direction. The politics of it, how it plays out, you're right, we can't tell. But this is a very, very big change of direction for the United Kingdom.
It sure is. And let's look at the response to this plan. We've got Keir Starmer from the Labor Party saying that the tax will be borne mostly by the UK's working population. The Scottish National Party says something to a similar effect as well. Is that the case from your understanding, that it is those who can least afford it who will be paying these extra taxes?
Taxes tend to be paid by people who are in work. And if you have a high income, a decent income, a professional income, a managerial income, you're running a school or something, yes, you'll pay more money. There are a lot of arguments about why there isn't a wealth tax element in all of this. We're all sitting in Britain, especially the baby boomer generation, on houses that have grown enormously in value. But unlike America or France or Switzerland, Germany, there's no tax on the increase in wealth in your house. Now, that's a debate that's going to unleash, but it's going to be difficult for the Labour Party to say the answer is vote Labour and pay more taxes and you'll get more money spent on the health service when Boris Johnson is doing that. But equally, it's very difficult for Boris Johnson to say, I am any longer connected to the Conservative Party of Margaret Thatcher, low tax, small state, encouraging entrepreneurship, when in fact the state's getting bigger and bigger.
Let's look at the response from the business community, because they're up in arms about it, because part of this tax rise will be borne by employers firstly through a 1.25 percentage point rise in the national insurance levy. Do you think businesses should be incurring these costs, given that they're already struggling to really get up to speed during the pandemic?
Look, we have a huge problem. The Health Secretary quite rightly said we've got massive waiting lists. I mean, nobody's had a simple operation for a cataract, for, I don't know, a small problem, a hip replacement, or something that's life-threatening, but still very important if it's paid for. All of these have been suspended for the last 20 months, partly because we have the highest death rate of COVID in Britain in the advanced world per capita, and partly, if I could be polemical a bit, I don't think Mr. Johnson has handled it as well as many other countries. So we've got a health service that's got this huge queue, because don't forget, in Britain there's very little private health insurance. You're either treated and seen by the state or you suffer in considerable pain. So quite rightly, money has to be given to that, but it's not solving social care. That is to say that many people, disabled people, old people, people with Alzheimer's in the last 2, 3, 4 years of their lives, not clear much money will go to them. So the issue won't go away. I'd add one tiny small thing. There's more and more evidence now that Brexit is causing firms enormous problems. I read one small report today, just a tiny example of a Scottish importer of olive oil from Spain. December last year, he was paying £250 to import his olive oil per pallet. You know, that's the delivery wooden pallet that the oil comes on. Today, and it took 14 days to arrive, today under Mr. Johnson's Brexit rules, he's paying £485 and it's taking 52 days to arrive. Now, there's tons of many stories in many different sectors. So the country isn't getting richer, it's actually getting poorer because we've lost all this easy trade access to our biggest trading partners in Europe.
Yes, that's an entirely different discussion, isn't it? Denis MacShane, former UK Minister for Europe, we do appreciate your time. Thank you again.